Evidence linking better cardiorespiratory fitness to improved health and longevity is overwhelming. In fact, maintaining cardiorespiratory fitness reduces the risk of chronic diseases and death more than any drug. In most people, cardiorespiratory fitness can be improved by performing moderate to intense physical activity on a consistent basis. Balance exercises can also help to prevent falls in older adults. Physical inactivity is the fourth leading risk factor for premature death worldwide. Being physically active is one of the most important things that you can do for your health. Everyone, regardless of age, gender, and ability, can benefit from regular exercise. Maintaining cardiorespiratory fitness reduces the risk of chronic diseases and death more than any drug. Regular exercise slows down how quickly the body ages, and it reduces the risk of cancer, dementia, osteoporosis, heart disease, stroke, depression, obesity, type 2 diabetes, and high blood pressure. Exercise, including aerobics, strength or resistance training, stretching, and high-intensity interval training, is one of the most powerful anti-aging strategies that there is. Exercise powerfully activates a major longevity factor called AMPK, or activated protein kinase, a key regulator of energy metabolism, and is linked to longevity. In addition, regular physical activity has been shown to support a healthy immune function, to enhance cognitive functioning, improve cardiovascular risk factors, and improve age-related loss of muscle mass, and more. Emerging research now shows that targeted natural interventions such as creatine, carnitine, branched-chain amino acids, glutamine, and vitamin D can help to maximize the health and longevity benefits of exercise. The most recent report from the US Department of Health and Human Services, updated in 2018, recommends that healthy adults engage in 150 minutes of moderate intensity aerobic activity, or 75 minutes of vigorous aerobic activity per week, or an equivalent combination, and strength or resistance training at least twice per week. The 2018 update also noted additional benefits can be obtained by engaging in more than 300 minutes of moderate intensity activity, or 150 minutes of vigorous intensity activity per week. Older adults should target 150 minutes of moderate intensity physical activity per week, or as much as their health and their ability allows. Additional activities that develop flexibility, agility, balance, and coordination, like yoga, are encouraged for all age groups. Studies in healthy older men have shown hormone replacement therapy increases exercise capacity and muscle strength. Post-menopausal women using conventional HRT had significantly greater improvements in exercise-induced insulin sensitivity than post-menopausal women not using HRT. Consuming a carbohydrate-containing meal 4 to 6 hours before exercise ensures adequate reserves of glycogen. This is stored carbohydrate energy in the muscle and the liver. The International Society of Sports Nutrition recommends protein and carbohydrate consumption within 3 hours after exercise. Studies suggest that caffeine ingested before or during exercise enhances the endurance exercise performance. For example, competitively trained males who ingested 5 milligrams per kg of body weight, equivalent to 2 to 4 cups of coffee for a 170-pound individual, lifted more total weight on the chest press, and they generated greater anaerobic power. In older adults, creatine supplementation, with or without resistance exercise, enhanced muscle strength and mass. It increased bone strength, and it slowed the rate of sarcopenia. Creatine doses used in the studies typically range from 5 to 21 grams per day for a 150-pound individual. Studies demonstrate that supplementation with 2 grams of L-carnitine can improve exercise performance and recovery. In a double-blind, placebo-controlled study, branched-chain amino acid supplementation for 3 days increased resistance to fatigue, and it enhanced fat burning for fuel during exhaustive endurance exercise. Sufficient blood levels of vitamin D are important for musculoskeletal injury prevention and for recovery, and are associated with reduced inflammation and pain, stronger muscles, and better athletic performance. In a controlled 2-week trial in male college-aged martial arts athletes, supplementation with 3 grams of glutamine daily for 2 weeks reduced muscle mass damage and prevented immune function decline, including during a strenuous training period. Physical inactivity is the 4th leading risk factor for premature death worldwide. Throughout human history, survival necessitated physical activity. Daily physical work defined and shaped the way the human body functions. Today, a general lack of physical activity directly contributes to many chronic diseases, and it reduces life expectancy by about as much as smoking or obesity. Physical inactivity may account for nearly 10% of all premature deaths. Evidence linking better cardiorespiratory fitness to improved health and longevity is overwhelming. In fact, maintaining cardiorespiratory fitness reduces the risk of chronic diseases and death more than any drug. Experts have called for a measurement of cardiorespiratory fitness, such as the sub-maximal VO2 max estimates, to be added to routine cardiovascular health screenings, alongside with more typical markers like cholesterol, blood pressure, and the hemoglobin A1C. Physical activity can include a variety of enjoyable activities like dancing, gardening, sightseeing, and other simple alternatives to sedentary behaviour. Even 75 minutes of brisk walking per week has been linked to longevity and substantial health benefits. At the cellular level, exercise protects the DNA against oxidative damage, and it rejuvenates energy-producing mitochondria. Exercise also activates AMPK, which is crucial as a regulator of energy metabolism. A comprehensive exercise program includes aerobic, muscle strengthening, flexibility, and balance exercises. Aerobic exercise is rhythmic and prolonged physical activity that elevates the heart and breathing rates. Examples of aerobic activity include fast walking, running, cycling, and swimming. Aerobic training increases cardiorespiratory fitness, it improves cerebral blood flow, and it reduces the risk of death due to heart disease and all-cause. Aerobic exercise refers to aerobic metabolism, where oxygen is used to regenerate the energy-storing molecule, ATP, or adenosine triphosphate, within the mitochondria. Glucose in the blood, glycogen, which is stored carbohydrate in the muscle cells, and free fatty acids in the blood and muscle cells provide fuel for the ATP production. Muscle strengthening or resistance exercise involves forceful muscle contractions against external resistance. This type of exercise increases muscle strength, size, and endurance, and it prevents sarcopenia, or age-related loss of muscle mass and strength. Strength training, when undertaken at an adequate pace, also improves cardiovascular endurance. Examples of muscle strengthening exercises include weight training, using free or machine weights, resistance bands, or body weight. Flexibility or stretching exercises entail slow and steady stretching of muscle groups. Stretches should be held for 10 to 60 seconds without jerking or bouncing, and repeated 2 or 3 times, progressively increasing the stretch. While mild discomfort is expected, flexibility exercises should not be painful, as pain can indicate minor muscle tearing. Flexibility exercises combined with muscle strengthening exercise improves the range of motion, and it relaxes muscles. Stretching before exercise can increase mental preparedness, but there's conflicting evidence as to whether it prevents an injury. Stretching after an exercise, when muscles are warm, might be more effective. Balance exercises, such as holding positions on one leg or using balance boards, might help individuals with awareness of motion and relative position problems, and it might help to prevent falls. The American Heart Association and the American College of Sports Medicine recommends balance exercises for individuals who fall often or who have mobility problems. The guidelines include recommendations for the following type of activities: increasing the difficulty of postures and decreasing the base of support, such as progressing from two-legged postures to one-leg postures. Movements that disturb the center of gravity, such as heel-to-toe walking and turning in place. Postures that stress certain muscle groups, such as standing on the toes or the heels. Reducing sensory input, such as standing with the eyes closed. And muscle strengthening exercises also improve balance by strengthening the muscles and the tendons that support the joints. Recent research has examined how different methods of exercise training affect various aspects of cellular biology, including the telomere activity and the telomere length. Telomeres are structural components at the end of the chromosomes, and these play a role in cellular aging and regeneration. During each cell division, the telomeres shorten. When they reach a critical length, the cell enters senescence. Shorter telomeres are associated with cardiovascular disease, obesity, and diabetes, as well as a reduced life expectancy. A healthy diet, non-sedentary lifestyle, and regular exercise are associated with longer telomeres. Telomerases are enzymes that add nucleotides to telomeres, thus regulating the telomere length. Research indicates telomeres can shorten in a progressive, age-related manner, but telomerase activity decreases steadily from the age of 4 to 39. After the age of 40, approximately 65% of people have low but stable telomerase activity levels, while approximately 35% have no detectable activity level. Studies indicate active adults have an upregulation of telomeric binding factor, and this protects the telomeres from shortening as compared to those who do not regularly exercise. Other observational studies suggest higher levels of physical activity are associated with longer telomeres, particularly in older individuals. This may be because exercise combats oxidative stress and inflammation. It alters telomerase activity, and it increases the number of skeletal muscle satellite cells, the skeletal muscle precursor cells that help to regenerate muscles after an injury. In one study, 124 healthy, previously inactive men were randomized into an aerobic endurance exercise group, a high-intensity interval group, a resistance training group, or a control group that didn't exercise. Each intervention involved 3 45-minute training sessions per week for 6 months. VO2 max was increased by all 3 training methods. Telomerase activity was upregulated 2 to 3-fold in the endurance and the interval training groups, but not in the resistance group. The white blood cell level increased in the endurance and the interval group also. A single bout of endurance training, but not resistance training, increased the telomerase activity in certain leukocytes. Thus, aerobic activity can promote cellular health and healthy aging. High-intensity interval training is becoming increasingly popular. This type of exercise training consists of short, repeated bursts of intense exercise followed by periods of recovery. High-intensity interval workouts can be performed using several different protocols. The high-intensity exertion phase can last from 5 seconds to 8 minutes, and it's followed by recovery periods of no or low-intensity exercise that can last as long as the active phase. During exertion, the heart rate reaches 80 to 90% of maximum. Perhaps the most common protocol involves 30 seconds of maximal effort cycling, followed by 4 minutes of recovery, with the cycle repeated 4 to 6 times per session, 3 times per week. Other less demanding formats have also been devised. In a 12-week study in previously sedentary men, a total exercise time of 30 minutes per week, of which only 3 minutes was intense exertion, was compared with 150 minutes per week of moderate intensity continuous training. Despite a 5-fold less time commitment, the interval training was found to to be equally effective as traditional endurance training and improving insulin sensitivity, cardiorespiratory fitness, and skeletal muscle mitochondrial content. Several other studies have indicated high-intensity interval training is superior to continuous moderate-intensity training for improving cardiorespiratory fitness, vascular endothelial function, insulin sensitivity, and arterial stiffness. High-intensity interval training also improves blood pressure and cholesterol profiles, promotes fat loss while maintaining muscle, and might be of particular benefit for those with or at risk of type 2 diabetes. In a review of studies in patients with lifestyle-induced chronic diseases, high-intensity interval training was nearly twice as effective as lower-intensity continuous exercise at improving cardiorespiratory fitness, a strong predictor of mortality. Despite perceptions that compliance with recommendations for more vigorous exercise is poor, a study in pre-diabetics found short-term adherence to high-intensity interval training was greater than traditional or continuous workouts. In another study, high-intensity interval running was perceived to be more enjoyable than continuous running. In addition, since a lack of time is a common cause for avoiding exercise, the shorter duration of the high-intensity interval training can be a major workout incentive. High-intensity interval training should be adjusted to a person's own fitness level. People with health conditions are advised to obtain medical clearance prior to starting the high-intensity interval training. For more information on herbs, supplements, and natural treatment plans, check out my website.